Minor Issue 1. HIV policy as a domestic priority. The Academy applauds President Biden's delivery on his promise to ban discrimination in healthcare on the basis of gender identity and sexual orientation. Protecting transgender Americans' access to healthcare and coverage, including medically necessary gender-affirming care, provides a vital step to ending the HIV epidemic in this country. The Academy also celebrates the largest ever replenishment of the Global Fund to fight HIV/AIDS, TB, and malaria, with donors pledging $15.7 billion. Major Issue: SH Institute Academy to host Sexual Health Institute at USCHA. The Academy will host a Sexual Health Institute at USCHA this year to equip participants with the framework to successfully negotiate this politically charged climate. Recent court decisions, the rise in STIs, and legislative attacks on healthcare have created the perfect storm created between providers and the people they serve. This institute will focus on centering sexual health as a part of primary care is an important response to this threat environment and emphasize the advocacy and intentionality by sexual healthcare providers need in order to regain lost ground. Through interactive discussion, participants will share advocacy best practices for overcoming structural challenges and getting providers off the sidelines. Participants of this institute will also learn how the decisions in Dobbs and Braidwood have affected the future of healthcare access, particularly sexual health care. How state and federal policies impact health equity in general and sexual health care access in particular for all people, especially those without private insurance. How the Academy's work to develop its sexual health curriculum through its internal validation study helps providers respond to current attacks on access. The Institute is also designed to launch a series of conversations between advocates, providers, and those they serve. If you'd like to stay in the loop, please send email to chauncey@am.org. Minor Issue 2, Policy and Clinical Practice, Black in the South HIV Awareness, Survivors, and NOLA Upcoming Events #SHAAD on Tuesday, August 20, 2024. Organizations across the southern U.S. commemorated the 6th Annual Southern HIV/AIDS Awareness Day. Southern AIDS Coalition launched this Awareness Day in 2019 for individuals all over the nation to join a movement to raise awareness, erase HIV-related stigma and discrimination, and to advocate for new and necessary resources and solutions to stem the tide of HIV in the South. We heard a panel of Southern leaders from Memphis, Tennessee, Baton Rouge, Louisiana, and Jacksonville, Florida discuss the HIV stigma exists in communities and strategies to end it. Upcoming event, BLK in the South Summit. The Academy is looking forward to the BLK in the South Summit, a one-day event designed to address HIV and provide innovative ideas, concepts, and frameworks for collaborative efforts to end the epidemic in the Black community in the South. Upcoming event, Xavier University, New Orleans, Louisiana. In celebration of Southern HIV/AIDS Awareness Day, we are also happy to share an upcoming event from George Nawaz, Farm D, BCPS. AHIP, our local member in New Orleans. In Pursuit of Justice, Navigating the Legal Landscape of HIV in Louisiana. This will be a live event hosted on the campus of Xavier University. AIDSVU HIV in Black Communities, PrEP in Black America, a new approach to biomedical HIV prevention advocacy. Minor Issue 3. Community collaborations and sign-ons, Medicaid-Medicare August 12th to August 12th to CMS Hep B vaccines for Medicare beneficiaries. You can view the letter here. Deadline, 5 p.m. Eastern, September 7th, 2024. CMS proposed rules sign-on letter. The Academy has joined the Immunization Alliance for Equity and Access and proposing that CMS expand access to hepatitis B vaccines by eliminating the requirement that a doctor's order be needed for the administration of a hepatitis B vaccine and expanding the types of locations where vaccinations can be reimbursed to the provider. Read the letter here. The Academy also encourages its members to submit their own public comments. The more community support, the greater the likelihood that CMS will finalize the rule. You can use this public comment template. It is best if you add information about you, your organization, and why increased access to hepatitis B vaccines is important. PrEP Equity 0A. RxEach Initiative upcoming event, the Academy will join the AIDS United PPC in New Orleans as it considers the RxEach Initiative. RxEach is a national coalition effort working to expand and sustain access to HIV prevention and linkage to care services in community pharmacies. Their mission is to broaden and sustain access to HIV prevention and linkage to care services through community pharmacies nationwide. They will provide an array of tools they have developed to assist states in effectively implementing these strategies, along with sharing valuable lessons learned from their experiences. 0B. Georgia PrEP Equity Community Index. In March 2024, the Black Public Health Academy held a meeting in which community leaders, professionals, and researchers launched the Georgia PrEP Equity Community Index, a Black-led and Black-focused community-engaged strategy to increase PrEP initiation and persistence among Black Georgians. The goal of the Georgia PSI is that every Black Georgian with indications for PrEP will have a pathway to receive it. The PSI uses 5 steps to carry out this coordinated task. Define the leadership as those who identify as Black or African American and reside in Georgia. Conduct an equity assessment for each health district, provide pathways for data sharing, develop a central location for assessing progress, and determine a timeline for the evaluation of the process. How to get involved? Join the listserv by completing the Georgia PrEP Equity Community Index form. Sign up for the newsletter at Home 0C. Prep Your Booty. Members of the Academy Policy Department will be attending Prep Your Booty, the launch of HPTN 106 Rev Up, August 29th webinar sponsored by HIV Prevention Trials Network. Date, Thursday, August 29th, 2024. Time, 9 a.m. to 10:30 a.m. Eastern Time. Click here to determine the time in your region. Register now. HPTN 106 is an innovative clinical trial from the HIV Prevention Trials Network that will investigate the safety and acceptability of a tenofovir-based rectal douche for HIV prevention among cisgender men and transgender women who have sex with men. Hear directly from researchers leading the study during this exciting webinar. 0D. Let's Talk LEN. Members of the Academy Policy Department will be attending Let's Talk LEN webinar, What Global Advances in HIV Prevention Mean for Black Communities in the U.S., discussing the groundbreaking results from the Purpose 1 trial conducted among cisgender Ugandan and South African women have changed the injectable PrEP global landscape. This webinar will explore the implications of these findings for U.S. Black populations. Click here for more info and to register. Date, August 29th, 2024. Time, 1:30 p.m. to 2:45 p.m. Eastern Time to 1. July 29th, Stop Insurer Barriers to PrEP. The Academy joined Yale HPTN 096 on a sign-on letter to urge CMS to take immediate action to include PrEP in the ACA risk adjustment model, as part of the Notice of Benefit and Payment Parameters 2026 rule to properly reward and incentivize insurers to increase PrEP uptake. Stop Insurer Barriers to PrEP 2. July 17th, to CMS eliminate cost sharing. The Academy joined 62 organizations in a sign-on letter requesting CMS to issue updated guidance to insurers, based on the most recent USPSTF recommendation, namely, new plans should be required to cover long-acting PrEP and ancillary services without cost sharing, prohibit prior authorizations, and include all future FDA-approved PrEP drugs. PrEP update request. To CMS sign on Final 17.17.24.PDF Appropriations 3. July 15th, Safe States Alliance FY25 opposing cuts to CDC budget. The Academy was one of 164 organizations representing the Injury and Violence Prevention Network and allied organizations that voiced their opposition to the proposed cuts outlined in the FY25 Labor HHS Appropriations Bill, which would slash the CDC's funding by 22%, include the elimination of the National Center for Injury Prevention and Control. 4. June 21, the Academy joined the NDD coalition sign-on in calling on Congress to reject arbitrary funding levels for FY25 and fund at a level that recognizes rising costs and need for investments, and keep poison pill policy writers out of the package.